Hello, my dear students. Welcome on the next psychiatry session, and I think you are going to enjoy it. It's regarding violence, neglect, and abuse. We're going to have a short session and we're going to do the salient features of violence, neglect, and abuse. Violence. What are the social determinants of violence? Repeated household moves and school changes. History of harming animals in this patient. Less intelligence and trouble delaying gratification. There are some important social factors, social determinants. Few more social factors. Television exposure to violence. History of violence, display and arrest in past. Poverty and easy availability of firearm. So there are some 8 important social factors, social determinants. As far as the parents are concerned, parents of this patient are concerned, are likely to exhibit or have been likely to be exhibiting the criminal behavior, use of drugs, abuse of drugs, alcoholism, and physical or sexual abuse. Unfortunate and sad, but this is the story of violence and these are the social determinants. As far as the biological determinants of violence are concerned, it's more common in males as compared to females, and probably the reason is androgenic steroids. History of head injury and the abnormal EEG, temporal hypothalamic frontal lesions, abnormal activity in the prepiriform area and amygdala, all these are biological determinants. Increased dopamine levels. You know, dopamine is supposed to be a neurotransmitter which exposes you to aggression and violence. So patients with schizophrenia who get command hallucinations and who have paranoid delusions, patients with bipolar disorder who have irritability and rage, and there is increased glutamate in this situation. These are the biological determinants. In addition, gamma-aminobutyric acid and 5-hydroxytryptamine, important to remember, they decrease the aggression. So please remember, whenever 5-HT is less, it means impulsiveness and it exposes you to violence. Cocaine is a substance which is related to dopamine. It inhibits the reuptake of the amines, and this is why there may be combative nature and there may be aggression due to the cocaine use. Use of PCP, phencyclidine, increases glutamate and this leads to excitation and this also might lead to aggression. Whereas a substance LSD, which is a psychedelic agent, produces a relaxation and this leads to absence of violence. It increases the 5-hydroxytryptamine. So please remember about LSD. LSD is not likely to lead to violence. Opiates also decrease the aggression, and benzodiazepines and barbiturates who potentiate the gamma-aminobutyric acid, because gamma-aminobutyric acid is supposed to decrease the aggression. Benzodiazepines and barbiturates, they are likely to produce less aggression. So these were the social and the biological determinants. Now we go to some of the disorders related to violence and related to the impulse control. The impulse control disorders. Number 1 is intermittent explosive disorder. It is abbreviated as IED, intermittent explosive disorder. And this patient gets episodes of loss of self-control. There is attack without adequate cause. This is more common in the males. And the onset in the late teens or in the early 20s. There may be minor central nervous system signs, what you call soft neurologic signs, like poor balance and incoordination. And there is no loss of reality testing in this condition. The differential diagnosis includes alcoholism and drug intoxication, where you might get strong neurologic signs, patients with psychosis, where there is loss of reality, patients with dementia, in which reality loss may be present in the later phases, and conduct disorder, antisocial personality disorder, and dissociative disorders. These are some other differential diagnoses. In the impulse control disorders, we also have pyromania, which is interest in the repetitive fire setting and attraction for fire. That's called pyromania. And this is more common in the males, and this is seen in children with conduct disorder, and these are the patients who are seeking the fire situations. You need to differentiate this from the curiosity, from the tangible gains for which the patient may be interested, and you have to differentiate from the impaired judgment and mental retardation, some important issues. So that's about pyromania. That's the second impulse control disorder. The third one is called kleptomania, in which there's impulse to take affordable things without paying. Go to shop and pick up something. Impulse to take affordable things without paying. It's very important to remember these patients, they do not pick up expensive articles. They might pick up non-expensive articles because only taking is the intent and the impulse is not controlled. So it's an impulse control disorder. That's kleptomania. You need to differentiate from stealing. You need to differentiate it from malingering, mania, and antisocial personalities, which might be difficult in certain situations. There is association of kleptomania with bulimia nervosa, and there might be 25% of cases who suffer from bulimia nervosa. And there's difficulty in the impulse control. That's the basic principle behind the disorder. Impulse control disorders continued. Pathological gambling or compulsive gambling is also an impulse control disorder. It happens in 1 to 3% of persons. And you need to differentiate from mania, in which there is mood elevation and the patient is likely to do these things. Trichotillomania is another impulse control disorder. Trichotillomania is pulling out own hair. And another one is trichophagia, that's eating the hair which you have pulled out. And this leads to trichobazars, might lead to intestinal obstruction and malnutrition. Now, when the patient has this loss of hair, you need to differentiate it from alopecia and you need to rule out the medical causes. You also need to rule out the obsessive compulsive disorder, because in this disorder, such a compulsion may be present. So you need to rule it out, and you might find some more other compulsions in patients with obsessive compulsive disorder. For all the impulse control disorders, the keyword is serotonin, and you need to use selective serotonin reuptake inhibitors, SSRIs. You can use benzodiazepines, antipsychotics, and mood stabilizers might be useful in appropriate situations. Now we move on to the child and elder abuse and neglect. What are the types of child or elderly abuse? There may be physical abuse, emotional or physical neglect, and there may be sexual abuse. One of the examples of physical abuse, a classical example, is battered child syndrome. You might find injuries in the skeleton, in the soft tissues, or the organs of a child due to repeated mistreatment or beating, usually by an individual who is responsible for the child's care. The individual who is likely to be doing it is likely to be a close relation or a caretaker of the child. Neglect. In the children, the neglect might lead to poor nutrition or poor personal care because the child is not provided with adequate food. That's poor nutrition and the poor personal care. In the elders, again, the example of neglect is poor nutrition, and second one is poor personal care, especially not supplying the required medication or the health care to the elderly. So these are the examples of child neglect and elder neglect. Now we move on to the injuries which we come across. First important injuries is bruises. Bruises are found in uncommon areas. That's very important, very salient feature of the injuries due to the abuse. Uncommon areas like buttocks and lower back in the children. The injuries might be bilateral and on the inner surfaces of the grabbed arms, on the inner surface of the grabbed arm. There may be brain or eye injuries which are produced due to shaking the child, and it's called shaken baby syndrome. The injuries may be present in the hidden areas and you need to examine the child carefully. There may be soft tissue bruising. It's not over the bony prominences, it's a soft tissue bruising, and there might be infant bruises. Belt or buckle shaped bruises are characteristic of abuse. The second type of injuries may be burns. For example, cigarette burns. These are found in the children as well as in the elderly. And on the hands, feet and buttock, you find the signs that this child has been immersed in hot water. So this is typically seen in the children. The next type of injuries may be fractures. In the elderly and the children both, you get fractures at different stages of healing. I request you to remember this particular keyword, the key sentence. Fractures at different stages of healing, because there's a repetitive abuse, repetitive beating. Spiral fractures, they are caused due to the twisting of the limbs. So spiral fracture is another characteristic. In the children, you might also find the fractures in the skull, the ribs, the spinal and clavicular fractures are also seen. The fractures may be seen on the edge of bone between the metaphysis and the epiphysis. This is a typical fracture and it's called bucket handle fracture. So bucket handle fracture is another important sign of the child abuse. Amongst the other signs of injury in children, you might find handprints on the face and neck. You might find petechiae due to the excess pressure, and the injuries may be present in the areas which are hidden by clothing. The shaken baby syndrome, which we already mentioned, there may be retinal and brain injuries. In both children and adult, you can find the injuries due to tying to a bed or chair. So you might have wrist rope burns or wrist rope injuries. In the mouth, you might find injuries due to forced feeding, and you might get internal abdominal injuries in the form of ruptured spleen. In the elderly, the common things which are observed are the multiple bruises on the face and on the arms, and depleting personal finances of the elderly is another way to abuse an elderly. What about the abuser? The abuser is likely to have substance abuse. The abuser may have poverty and social isolation. You try to search the closest family member, he is likely to be involved, and there may be personal history of victimization as far as this abuser is concerned. As far as the abused are concerned, the children, they may be premature or LBW, that is low birth weight babies, hyperactive or with physical disabilities, or slow, different and fussy children. They might be abused, and the chances are more in females. The abuse is seen in 1/3 of the patients who are younger than 5 years of age, and in 1/4 of the patients who are between the age 5 and 9 years. As far as the elders are concerned, the abused elders, they might be suffering from dementia, they might be suffering from some serious illness, they might be physically dependent on someone, and usually the elders, they do not report the abuse. If you ask them what's the reason of this injury, the elderly person is likely to give the history of self-injury. So that's a very typical character seen in the elders. Now we move on to sexual abuse. The children are abused especially between the age 8 and 13 years, and the abuse is done by someone who is known to the child. The abuser is mostly a male, so it's done mostly by men, and almost half by relatives or the family acquaintances like the teachers or the neighbors or the caretakers. They may be either true pedophiles or those with marital problems and having no sex partners. And alcoholism and drug abuse is common in these abusers. How to detect the child abuse? Presence of a sexually transmitted disease in a child is one of the important criterion to decide that it would be child sexual abuse. There may be genital trauma and there may be recurrent urinary tract infections. Excess knowledge found in a child regarding the sex issues and the excess interest in the sex shown by the child may be another indication to detect the child sexual abuse. The effects of child abuse are serious. There may be psychological disorders. Various dissociative disorders can manifest due to the child abuse. Borderline personality disorders, there is a susceptibility to this. There is susceptibility to post-traumatic stress disorders, anxiety, depression, substance abuse, and sexual disorders. And the children who are abused are likely to exhibit violent behavior in the adulthood. And they might go for abuse of own children. And these patients are found to have lower 5-hydroxytryptamine levels. Again, the impulse control is in problem. Group therapy, family therapy, and individual therapy are the various methods practiced to treat the abuse and to take care. As far as the domestic partners are concerned, common cause of injury in women is the domestic abuse, and it's done by the domestic partners. You might find bruises, you might find broken bones. Who are the ladies who are the women who are likely to be abused, especially pregnant women, the women who are dependent. There may be injuries to breast and the abdomen, which is very less likely in ordinary situation. Injuries on the breast and injuries on the abdomen, and this area is called as baby zone. So baby zone injuries is a very typical feature of this abuse. There may be history of miscarriage or preterm labor, and there is no adequate explanation for the injuries. The patient might be suffering from depression. The patient might have a recent HIV diagnosis, and the patient might be found to have low self-esteem. So I just tried to describe you what kind of women are more susceptible, more victimized by the domestic partners. The abuser is most commonly a male, might be suffering from alcoholism, might be indulged in drugs, might be impulsive, might be an angry personality, and shows loving or apologetic behavior for the abuse. That's very surprising. So if the two individuals, if the couple is for counseling, the husband might show a very loving attitude towards his wife, and this person may be an abuser. Normally, this person is likely to have the other characters like alcoholism, substance abuse, impulsiveness, and angry character. What's the role of physician in these situations? As far as the child or elderly are concerned, the suspected abuse has to be reported and take care of the treatment, whatever we discussed. As far as the domestic partner abuse, you have to go for adequate documentation, and most important thing is ensure the safety of the abused in the first place. Then emotional support, referring to shelter or program, and encouraging the abused for reporting to law officials. So this particular woman who is sitting in front of you, in first place, you try to ensure her safety as soon as she gets out of your clinic. That's number one. Try to give emotional support, do adequate documentation, and encourage the abused for reporting to the law officials. So what we did on this particular module is various types of injuries which are seen in the children as well as in the elderly patients. We have also gone through the various disorders which are impulse control disorders, and we saw some neurotransmitters involved. And finally, we discussed abuse in details with the role of physician in these situations. What I advise you is try to listen to this particular module again and again, and try to make a list of those kinds of injuries which are commonly seen in children, and this becomes a very high yield issue as far as solving your multiple choice questions. I'm sure you will do well. Don't worry. Best of luck, and thanks for listening.